Hello dear colleagues, how are you today? I hope you are well. Here we are going to explain another question of cardiology. A 69-year-old man was successfully thrombolyzed for an inferior myocardial infarction 15 days ago and was discharged 5 days after the thrombolysis. He is now readmitted as he is hypotensive, tachycardic, and with pulmonary edema. Okay, the patient 5 days after MRI is coming with hypotension, tachycardia, and pulmonary edema. What is the most single likely diagnosis? A. Aortic regurgitation. B. Acute mitral regurgitation. C. Mitral valve prolapse. D. Pulmonary stenosis. And E. Rheumatic mitral valve stenosis. And the answer is acute mitral regurgitation. And here we are going to explain it. Okay. Explanation. Acute mitral regurgitation post-MI. This is a mitral regurgitation due to ischemic papillary muscle dysfunction or partial rupture. It is usually seen 2 to 10 days post-myocardial infarction. It is more commonly associated with inferior myocardial infarction than anterior myocardial infarction. Silent MR is quite frequent and must be suspected in any post-MI patient with unexplained hemodynamic deterioration. In this diagram, we can see normal mitral valve. When the left ventricle contracts, the mitral valve must be completely closed and the blood must enter to the aortic wall. But when the patient has mitral regurgitation due to the damage to the papillary muscles because of MI, especially inferior MI, we have problem in closing the mitral valve, and some of the valves re-enter to the left atrium from the left ventricle and from left atrium to the lungs, and this leads to pulmonary edema, as we can see in our patient. Okay, diagnosis is usually with echocardiogram. Okay, note. Mitral regurgitation murmur is a pansystolic murmur at the fifth intercostal space in the left midclavicular line, which radiates to the axilla. Treatment is acute MR is treated with vasodilator therapy, but often requires emergency surgical repair because in the MI, as we said, when the patient has inferior MI, the problem is not all the mitral valve itself, but the problem is all the papillary muscles which are ruptured or dysfunction, and this leads to dysfunction of the mitral valve, and the treatment is usually repair of the rupture of the papillary muscle. This was a short explanation for mitral regurgitation. For hearing the voice of mitral regurgitation, you can watch our YouTube videos. There we are explaining it. Thank you for your attention.